There's a new trend in healthcare this new year. Both concierge medicine and direct primary care are experiencing significant growth. Find out why it might be more affordable than you think, because Bloom Health Club starts now.
From the Stream Center, welcome to Bloom Health Club, sponsored by Monticciolo Family and Sedation Dentistry.
I am your host, Gayle Guyardo. Physician burnout, patients wanting better access and relationships with their providers, and people just really tired of being sick and tired and dealing with the insurance companies are leading to a huge growth in both concierge medicine and direct primary care. Here to explain is our latest Bloom Health Club guest, board-certified internal medicine physician, Dr. Rishi Seth. Dr. Seth, thank you so much for being here.
Thank you for the invitation. I really appreciate it.
So this is a growing trend. More and more people are fed up with the healthcare system, the cost of it, and not really getting the outcomes that they want.
That's right. And the cost, I think, is the one that's worrying everybody. Really, like at the end of the day, there's healthcare issues. Everybody wants to be healthier. I think that after the pandemic, a lot of people wanted to know about their overall health and make sure their overall wellness is focused on. But then you stick a big tag on it, and with the prices going up at the grocery store, it's hard to envision spending more for your health.
Right. But at the end of the day, and I know this because out of pure frustration of dealing with the thyroid issue for many, many years. I mean, I lost a lot of hair. I had to invest in a wig just to do my job because it was like falling out in clumps. I did wait in 8-month lines to get to see a top physician, or would go for the 10-minute, 15-minute wellness checks, and I never got the answers I needed. So I paid out of pocket for concierge medicine, and I ended up staying in that lane because, quite frankly, it was saving me more money in the long run.
Mm-hmm. Yep. So that's what we do in concierge. In concierge medicine, our patient panels are small. So in other words, the average physician in Tampa and St. Petersburg has to have between 1,500 and 2,000 patients just to stay open. Normal physician groups have to have 3,000 patients per physician to be profitable. Okay? So in other words, for them, their clinics to keep running, you need a lot of patients. The reason for that is physician reimbursement payments have gone down significantly over the past 30 years. So per patient, they pay you less and less. Therefore, you have to see more patients. So from a physician standpoint, that's where that burnout happens, where imagine to see 3,000 patients in 1 year, you have to see 30, 40 patients a day. And that's not, you can't make good care out of it. So imagine I have to see 30 patients a day and then be asked, why aren't you giving great care? It's virtually impossible. Right? So concierge has come out of that, and direct primary care has come out of that. Direct primary care is where a physician says, forget the insurance, I don't want to do any of it. So if you want to be a part of a direct primary care practice, the person has to pay completely 100% out of pocket. Some practices can have a small amount of payments. It'd be $100 a month, $50 a month. Some can do $300, $400, $500, $600 a month. It really depends on what that physician wants to do with the size of their practice. The smaller their payment, the larger their panels, right? So that's really what direct primary care is, and they do a fantastic job. We have some friends who are direct primary care pediatricians. They're phenomenal. Their patients are super, super thankful for their accessibility, and that doctor chooses to have a certain set amount of patients that they have, and they have a very affordable process. Again, it's not covered with insurance. And now with the big, beautiful bill, some of those payments can be paid for by if a patient has HSA coverage. Concierge medicine is a little bit different in that we do accept insurance, but we have a fee, and that fee is purely for direct access. So in your case, for example, you were waiting 8 months for evaluation. Now, 24 hours, I get the guarantee you are being seen. To be guaranteed to be seen, I can only see 300 patients a year. I can only have a limit of 300 patients because fundamentally, I'm promising you that I am at your beck and call. Now, we try our best to make sure that we are always available. Of course, there's always some ups and downs, like, you know, a weekend or middle of the night. But for all intents and purposes, we do everything we can. And that's what majority concierge docs do. And the other thing is, and I think I was just talking about this with my resident here, you know, financially, we're incentivized. We're incentivized to make sure that you're really, really well taken care of, right? If I know that my patient is paying directly out of pocket, I'm going to do my darndest to make sure all the ends are met, to make sure that their appointments are addressed. Did you speak to your cardiologist? Did you speak to your did you get your colonoscopy? Why didn't you? Was an issue with your insurance? Let me call. Let me write that letter. Let me make sure I take care of that. I don't think any clinic that does traditional medicine can handle that volume of stuff.
Yeah.
Right? And then on top of it, if they promise to handle it, they got to hire staff. That increases their expenses. What does that mean? I got to see more patients. It's too difficult.
It's too difficult. I want to bring in Nacha Castilla, who is our producer of Bloom and punching the show on Bloom Health Club today. Feel free to jump in at any time. We're talking about healthcare as it stands in this country right now, and I don't care what side of the political spectrum that you are on. Nobody can say that it's working properly.
Right.
It's a disaster. And, a lot of people are arguing, do we throw good money after bad? But what I learned personally researching this is that most doctors' offices are now run by hospitals. 90% of doctor training is by pharmaceuticals. So basically, that has become a numbers game of just churning out patients, like you're saying, like thousands and thousands of patients every year that you've got to see. Same holds true with why the system of affordable care and so many insurance companies is like the patient is left in the lurch.
Right, absolutely. So when it comes to hospital systems buying out clinics, essentially this sort of thing changed in the past 100 years. 100 years ago, you used to go down the street, you had your own clinic, you saw your own doctor, took care of your own care that way. Now, with the advent of Affordable Care Act and the incentivization for hospitals to get bigger, they decided that it's in their best interest to get bigger and bigger clinics. And so what ended up happening is that the patient volume increased in these places. And the purpose was not to have, overreaching care, but their goal was to make sure that patients were all taken care of. And it made sense. What's eventually happened is that big systems got bigger, very big, almost too big to fail, and no, clinic around the corner. Now, I'll give you an example. If you want to have a great burger, you go to a burger restaurant. But if the only burger available was McDonald's, you'd say all burgers are terrible. And that's not true, right? There's some great burgers. They may be at smaller places that you like that kind of care. And maybe some people like McDonald's. But the over big system is not necessarily for everybody, right? It's for a lot of people, but it's not for everybody. The same thing goes in the healthcare sphere, where the big systems have definitely purchased a large amount of these clinics. These clinics have then been eaten up and swallowed, and now they're in the run-of-the-mill of the system. And what we are doing now is kind of bucking that trend.
And a lot of doctors are bucking that trend because we are seeing more primary care, direct primary care, I should say, and more concierge services opening up by leaps and bounds. So my big question is, will we be able to make the math work out? Because for me, with my, our family we've got, I think, 4 under our insurance plan right now, not 6 any longer. But at the end of the day, the deductible is ridiculously high and the monthly payments are ridiculously high. And I'm not being critical because there are so many great doctors that are doing their best, but the care is not where it needs to be under that traditional, that blueprint plan.
Yeah, let's talk about the insurance. So insurance was originally developed to start, I think the story was out of the Gray Nuns out of Texas, out of Houston, where there was the advent and the origination of Blue Cross Blue Shield, where originally the plan was so that a small group of people can afford care if needed for a small amount of price, right? It makes sense. What is developed now is healthcare now has become preventative, has become intensive care, has developed into all sorts of levels of care, whether it's seeing a cardiologist, a GI, a preventative doctor. Insurance was never really initially meant to take that. So, but now insurance has grown, and insurance is trying to pay for all this. And what has eventually come up is insurance also wants to get paid too. So they've raised their profit margins. They've realized that their expenses are high. The hospitals are trying to, obviously take care of their own and pay for it. It's a numbers game. I don't blame anyone for this situation. I think our response to medicine has to be such that my patient comes to my clinic, I got to do whatever I can to not only make their medical care better, but to make sure their financial health from their medical isn't killing them, right? Because it's not fair for me to make sure that I prescribe, a medication that's life-saving and then send them a bill of through their insurance and no options. So what we do is we look at the lab prices. Let's say we have patients who come in and say, well, we got to get some labs. So, okay, I run their labs. Now, technically, it's got to go through the deductible, right? That deductible, if it's $2,500, that lab could be $1,200. So then myself and my wife is the manager of the clinic. We look at it and run it through cash, and we say, what's the option? What's the price difference? It's $80. $80 for cash? Yeah, well, because we don't take any money off it. Would you like to pay $80 or would you like to pay your $1,200 deductible? Well, I'd rather pay the $80 cash. Sure. That seems better than the other options. So we try to make sure that whatever the costs are in regards to concierge, that we try to help mitigate the additional costs.
Yeah, it was cheaper for me to pay cash to get a mammogram than pay a deductible at one point. Like you're playing this game with the insurance companies. You think you're being covered, but really you're just getting some high ticket price and nobody's held accountable. Nacha, I want to bring you in because I know you've navigated a lot the healthcare system, and you and I have talked about this in the Bloom office behind the scenes about even you, a young woman, are considering going, into concierge medicine or direct primary care.
Yes, we've definitely talked about it behind the scenes, and it's really interesting because I think, especially after started working with Bloom and hearing a lot of your personal story, it seems like you get quicker answers and a more personalized, tailored care when you choose kind of like going the concierge and primary care route. And I guess I'm wondering also, with the growing tension in the way that the healthcare business is going, is there potentially a future where this demand for primary care services and concierge services grow, that it could change the way that we see healthcare?
Absolutely.
It's a great question.
It's absolutely. So let's talk about the current state. The current state is patients are not excited about their primary care. Their medical care is great as long as they check all the boxes, right? They may not see their physician. That's a big thing. Lack of continuity of care. So you see your doctor once, then you go and follow up. Oh, you see somebody who's filling in, and you see their nurse practitioner. So you've seen 5 providers before you've actually taken care of yourself, right? Mm-hmm. That's a huge thing. Now think of the difference between, and then on top of it, your deductible is like, I don't know, $3,500, right? So no continuity of care, lots of questions, shortened visits, and then it's expensive, right? So the difference now is that direct primary care and concierge medicine are the response for this, right? They are saying, we have an alternative. In 2 years, concierge medicine has exploded in South Florida, right? In South Florida, I'll give you an example. You ever see those Tampa Top Docs magazines? 3 years ago, majority of those on the advertising was orthopedic surgeon, plastic surgeons, and some primary care.
I remember that, yeah.
If you look at this year's 2025, they're almost all concierge primary care.
And those are all advertisements, correct?
That's right.
Yeah.
The
you
point
pay
is,
to be...
that point is there's demand and there's guys leaving the system to go and make their own. They see there's enough demand that they want to get out in there. So I think the demand is there. That's huge. And honestly, this is going to be a political thing. When patients start to see their deductibles and they have to pay it, that's a tax. And I have heard that Americans don't like taxes, right? So I assure you that at one point something will happen. Whether that is acceptance in the Big Beautiful Bill this year, the first time language was put in that concierge and direct primary care can have payments from their HSA.
Which is great.
That's huge.
That's huge.
Yeah. And I think it's like $350 a month from the HSA. Now, don't quote me on that one. I think it's $300 for a couple and $150 per person. So for example, in our clinic, we have family plans, right? That is a big expense that's cut down from an HSA that prior to that was paying very expensive deductibles.
Right.
Right?
So now you're using your HSA account to direct your own healthcare. Right. Like the insurance companies aren't driving your care.
Right.
And that's the other thing. Like, so let's say I wanted to go back to my regular insurance plan and my primary care doc, who is a wonderful woman. I absolutely loved her. But she's like, Gayle, I cannot compound your thyroid medicine.
Yep.
The insurance company is not going to pay for that. So I have to go to a concierge doctor and get this prescribed. And anytime it's off, instead of like upping the medicine, she'll do some kind of detox or something that gets rid of the endocrine disruptors or whatever's causing my thyroid to go haywire. And it falls into place. So not only am I getting the medicine I need and the outcomes that I want, but I'm also getting alternative to just another script.
Sure. And I think that's something that concierge is going to struggle with in the next few years, because there's a lot of people that are coming out of the traditional medicine landscape, like myself, and going into a form of care where people like yourself are looking for alternative options. So it's very easy for us to say, I don't know, I'm not going to deal with it. I mean, I'm going to be honest with you. I had not dealt with, in my hospital career, hormone replacement therapy extensively. Right. And for the past 2 years, I've had to do a lot of extensive training and learning about it, but I'm willing to understand and embrace it for my patients, right? So that being said, I think concierge medicine doctors are going to have to learn a little bit about that. That's, I think, going to be some, a little bit of the waters, rough waters that they're going to have to deal with. But I don't think that's a ton of stuff. I do think from a medical standpoint, we have, as physicians, we have to be honest and sincere about the medical stuff, because there's a lot of crazy stuff out there. So we have to balance it with good medical care that's really medically savvy and understood like the literature behind it, and then educate our patients to say, well, this thing is not healthy or not going to do the benefit that you're looking for, rather than taking your traditional medicine, which is going to help, do, for example, lower your blood sugar or your cholesterol or something like that.
Okay, let's get to some viewer questions, as many as we can fit in.
Yeah.
Barbara wants to know, why are alternative models of medicine growing in popularity?
I love this question. This is a question that it sings to my heart, because my mom was a breast cancer patient. She passed away 11 years to this date.
I'm sorry.
Yeah, but she was not a traditional medicine fan. Her son went into traditional medicine, but she was not a traditional medicine fan. And she would find any other alternatives, whether it's food or non-related. The reality of why alternative options are growing is because people aren't getting the answers they're looking for, right? Traditional medicine has done a terrible job explaining itself. I would argue that during COVID, we did a terrible job because we wagged our finger a lot and we said, you need to do this because we say so. And that is not a way to manage medical care. We have to educate our patients. We got to embrace their culture. We got to understand their values. And I think that's where alternative medicines have grown a lot, where patients were sick and tired of having doctors and institutions wag their fingers and say, if you don't want to listen to us, there's no other options. And unfortunately, that made a lot of patients go, well, I'm just going to go to the different option because it's available. And it may not produce the benefits that they're looking for, but at least somebody's listening to them. I think that's a big thing.
All right. Melanie asks, what's coming next in healthcare?
Well, I think concierge medicine is coming.
Yeah, the numbers show it's true.
I think medicine is going to go through quite a bit of upheaval in the next 3 to 5 years. I think primary care is going to be major changes. I also think AI is going to be a big component in healthcare, whether it is advancing healthcare, whether it is advancing the insurance models and stuff like that. But I think things will improve from a primary care as long as concierge is growing.
I love it. All right. Last but not least, Thomas wants to know, how can strengthening primary care reduce cost, improve outcomes, and rebuild trust in the healthcare system?
Huge. This is the big picture. The major costs that happen in the end of life of patients is the intensive care unit. If you had a primary care doctor who understood your risks, medical issues from the get-go, they could talk to you throughout your life and say, hey, I anticipate you might get sick. And if that happens, are you sure you'd want really long intensive care? Are you sure you want to be in the ICU for 30, 40 days? Is that how you want to live the end of your life? Most of my patients don't say they want that. And so simple discussion, simple continuity of care, simple understanding of patients' values, and keeping that relationship is important for the future when we say, oh, you're in the ICU, what do you need to do? Most patients will say, if they understand, they've been educated about it, they'll say, I don't want this. I don't want to live with tubes down my throat and feeding tubes and stuff like that for the last 30 to 40 days, even longer. Most patients will be very reasonable about their health care. They want to embrace their end of life. And that, I think, starts with the primary care.
Yeah. And you know, the research is out and it shows that, you know, palliative care, hospice, you go that route instead of that emergency, you know, tubes and all this interference, you actually live longer and you have a more peaceful way out. And I witnessed that firsthand with my late mother. You know, the doctors came to me and said, enough is enough. Like, she was the fighter in the equation. She's the one that went back asking for more. And I would say that last 30 days that I was with her and by her side in hospice care was the most beautiful time with her. So it is, you know, it's not something to be taken lightly. And hopefully, to your point, with more doctors like you guiding the patients, they don't go through that rough ending and they have a more peaceful end of life where most of the money is spent, like you say, end of life emergency care. And there's no light at the end of that tunnel, correct?
No, absolutely. And the unsung heroes in today's healthcare is really the hospice providers, the hospice nurses, the hospice doctors. The amount of time they spend with their patients, holding hands, focusing on comfort, making sure that their last few days, weeks, months are comfortable. It's the most beautiful thing in the world.
It really is so beautiful. And not only do they do that with their patients, but they also do it with the family members because we're facing burnout. Many caregivers are juggling jobs, kids, aging parents. It's not an easy road to go down. And I will say that, you know, many thanks to the hospice folks that came into our lives. And thank you, Dr. Rishi, for coming on Bloom Health Club and kind of, you know, unpacking a very complicated situation. And hopefully we see our lawmakers go to work and do more great things for us. Thank you.
Thank you.
And hey, a special thanks to Monticciolo Family and Sedation Dentistry for believing in Bloom Health Club so we can get this messaging out to you. And you can watch our streaming show, Bloom Health Club, on Apple TV, Fire TV, Roku, Samsung TV, WFLA.com, and YouTube, Spotify, and Apple Podcast. I will see you on the next Bloom Health Club.